well-documented evidence about what safe levels of drinking are.
I know my body. Your opinion is totally different from my experience.
Sure.
I'm going to tap on the legs, and I want you to say yes when you feel me tap, OK?
Sorry.
How much are you drinking at the moment?
As much as I can. I start drinking first thing in the morning. As soon as I open my eyes, I drink till I pass out.
You're feeling any easier?
Yeah, I feel a lot easier.
Curious, aren't you?
Barnaway Surgery, Cindy speaking. How can I help?
Hello, I've got an appointment booked for my son, Louis Hugh.
What's up, Annie baby? You didn't bring in any chocolates?
Hello, Evelyn.
Oh,
You've been good?
Well, don't know about that.
Tried to talk him out of it.
Yeah. Have a seat there.
She's not been too bad.
Oh, okay. You've been good.
Yeah, no more practicing for the Olympics.
91.
Yeah, 91 runs rings round me. She's got more marbles than I have.
And though it looks red, it's not
Painful. Don't want to leave the remaining skin.
Trouble is your skin's so thin,
Yeah, I
it
know.
tears,
I do
so
know.
it's like... You'd make a great tissue.
Oh, dear.
Oh, that's lovely. 10 off. It's great.
Does it feel itchy?
At the top part.
Does it look better?
Let's have a look. It looks like the fluid is gathering at the bottom there. By the time you finish your antibiotics, yeah?
But can you imagine when she rang me and said, I've scratched my leg?
Oh, dear. Yeah, yeah.
It's not what I class that. Look.
You wouldn't classify that as
That's
a scratch.
a scratch.
That's a scratch.
Scratch.
And tell her why. Tell her why you've got
that.
And yeah, these are scratches from doing her garden.
Oh, did you?
It's lovely because that's the first time I've had to ask any of you to do things like that.
Yeah?
Yeah.
We intend to do things like that, but by the time we get round, you've already had done it.
Yeah.
Oh, she's already done it.
Oh, she's worse than a child.
Oh, it's good to be
I know.
independent, but
there's just really unnecessary.
you still got to look after yourself. All done?
Yeah, I'll have to get the girls to cut my toenails.
That's down to them. I don't do feet.
No, but they do that, don't they?
Yeah, they can do that. I don't.
All right.
That's my granddaughter's.
Oh, she's gonna do that.
They're beauty therapists, so they're used to feet.
Oh.
That's what I'm. That's why I'm so used.
Yeah, there you go, Thelma.
Well, you're such a stunner.
All done?
Yeah, you're lovely.
Yeah, and...
Oh, how lovely. She's my friend.
Well, I'm going to leave you here then if you carry on like that.
Mind that chair, mind that chair.
I know.
Yeah, all right. Okay, we'll see you on Tuesday.
Yeah, definitely.
Right?
Thanks,
Okay.
hon. You have a lovely weekend.
Okay, you too. Bye-bye. Bye-bye. Bye. Bye.
I send apologies to you.
You apologise to
You were the first person that I blamed for that. You were. Then it was Riff. Then I found out it was Little Miss Butter wouldn't melt in her mouth.
I wouldn't do anything so infantile.
I thought it was very clever that she thinks my bits and boobs look like that.
I put the red dot in the middle afterwards.
You think the other one's inverted?
Yes. Got an inverted nipple and you see a doctor.
There we go. I'm Dr. Tawana. Nice to see you.
Nice to meet you.
How are you?
Okay, thank you. It's unfortunately it's Louis who seems a little unwell.
Okay.
Yeah, he's just got a temperature today.
Yeah.
37.9.
Okay.
Last time I
Last time you checked,
Yeah.
okay. We say up to 37.5 is normal.
Right.
Okay, so going up to 37.9, it could simply be that he is warmer.
Right.
And that his body just hasn't been quick to regulate his body temperature. How long has he had that kind of gentle kind of rise in his temperature?
That was this morning.
Just this morning?
Yeah.
Okay.
Also, his nappies are smelling a little bit stronger than usual, but
yeah.
only by a tad.
Okay, so and that's urine rather than the poos, would you say?
Poo seems sort of normal.
Is he peeing normally?
Yeah.
Yeah, that side of things is
plenty of wet
fine.
nappies, yeah.
Good. Hi, young man.
Hello.
Hello.
Can you say hello to the doctor?
Has there been anything coming out of his ears at all?
No.
Good. Temperature 37.7, so it's kind of just slightly above the kind of threshold. If you hold him looking towards you, I'm just going to have a quick check in and around his neck. Talk to Mummy.
Hey.
Say hi.
You're not going to say hello to me? Louis.
Okay, so no glands that I can feel. And actually, while you're holding him like that, I'll have a listen to the back of his lungs. That's it. That's lovely. Perfect. Okay. If we swivel him round just a little bit, actually, if you wanted, you can lie him down across your laps. I'm just going to press on his tummy. That's perfect, just as you are. Hi, young man.
Hi.
Lips are moist, which is very good. Hi. He's got a lovely,
You're not gonna say hello?
lovely colour about him. He's not struggling to breathe, which is brilliant.
You enjoying that little massage there?
Yes. Don't normally get this on the NHS.
No.
That's a lovely smile there, young man. We're going to shine a light just in his throat, just to see how that looks. Here we go.
Good boy, aren't you?
Very quickly. It does make them gag a little bit.
Aww.
All done. Perfect.
Okay, good
So,
boy.
no sign of any obvious infections there. He's well hydrated, lovely colour, breathing beautifully. No sign of any infection anywhere. You look very well, young man. So no concerns from my point of view.
All right. Are you happy?
He certainly is. He looks it.
Thank you so much.
You're most welcome.
Right, say bye to the doctor now.
You're going to wave. We're going to wave. There's a bit of a kind of opening of his hands there. Fantastic. Take care.
Okay,
All the best. Bye.
Bye now.
Hello.
My partner comes in with me.
That's all right, as long as you're happy.
Yes.
Yeah? Yeah, have a sip.
Thank you.
My name is Dr. Bajwala. And how can I help you, Gary?
I suffer with alcoholism and I've been drinking and drinking for 30 odd years and it's made me ill. I've been in hospital. But the last year or so it's cost me my marriage and I'm getting iller and iller. And I really now know I need help and I want to get better. I know you haven't got a miracle pill or injection, but please, I need help.
Okay, so it's a little bit inflamed in that area. So we'll have one more go.
You're the boss.
You need to come to my house and tell them that.
I'm all for keeping yourself alive.
Yeah.
Have to be honest with things, don't you?
I want to live longer.
Yeah, okay.
I'm ever so glad I come now.
Yes, you've done absolutely the right thing.
Thank you so much for putting up with me. I do appreciate everything you've done.
You just say thank you.
Oh, Dwayne, thank you so much.
No worries. Thank you very much for doing that.
No
I
problem.
appreciate what you've done so far as well.
Oh, no problem. That's really nice of you. Absolutely not necessary. It's part of my job.
So I understand your main issue is alcohol problem, and obviously it's affecting your life now.
Yes.
And you want to be cleaner.
Yes.
So how much you're drinking at the moment?
As much as I can. I start drinking first thing in the morning. As soon as I open my eyes, I drink till I pass out. Wake up, drink again, till I pass out. Sometimes I don't eat for
What do you
3 or 4
drink?
days. Anything. But this morning, last night, I promised my
Stella,
grandson I'd never
how many
drink
cans does he normally have?
Between 8 and 16 a day.
8 and 16 a day.
Yeah.
Anything else does he drink?
No, not really.
No?
This morning I got up and drank her vodka.
Yeah.
I found vodka. And that's
Yeah.
what I've done.
Have you seen any alcohol treatment before?
Yes, years ago, but keep thinking I
Many
can get
years
myself
ago.
better.
Many years ago.
All right. Okay. Yeah. Yeah. Are you eating all right?
No, I don't hardly eat at all, Donnie.
All
I
right.
could go 4 or 5 days with no food. I don't care if you put me to sleep.
Can I have a look at your hands?
Oh, that's my...
Yeah, we showed the doctor your hand. That's what you told me the other day.
Oh, just see, I punch things. I get so angry.
You're going to make a fist?
It's all right. It's a little bit sore, honestly. But it's not about that. It's
Can I have a
about-
look?
It's in there.
Okay. That's all right. Okay.
But this is the first time I really know I need help. I can't do it on my own.
I need to give you the phone numbers and address where you can see this alcohol nurse. You see them, they assess you, they'll ask for the blood test, and they give you community detox. Yeah?
Yeah, I'll try anything. Yeah.
Because what we have done studies in the past where I can give you tablets, but without support it never works. Yeah? I don't want you to stop drinking all of a sudden, because then you will start having withdrawals and you could end up having fits, which is not right. Okay? Regarding this punching, I think it'd be better to have an X-ray.
That's okay. It's just a little thing.
If you want to have an X-ray, I can
No,
book
it's
it.
fine, honestly. It's not. That's
If you
not
change your
right.
mind, let us know.
Okay.
Yeah? Okay?
Thank you very much. And you can't just stop drinking, can you? You're going to get help.
So, Gary, this works as a self-referral. So, if you're committed, you need to ring them and make an appointment. Yeah?
Yeah. It's a long time.
Okay. That's a blood form, which is very important. So, once the bloods are done, make an appointment after 4 or 5 days to see the doctor to discuss the blood results. And once they assess you and bloods are done, and if you agree with it, then they will give you community detox so that you can stop drinking. And then after that, they give you support so that you don't start drinking again. You can also go to Alcohol Anonymous as well once you're clean, so that helps you. Or you can start now if you're really keen on it. Okay. All right.
Thank you very much, Doctor.
Okay.
Thank you for your time.
All right, but don't stop drinking all of a sudden. Yeah? Okay?
Thank you.
Okay.
Thank you.
Yeah, bye.
Bye-bye.
When I was a kid, I got some glass in my foot and it'd gone septic. So they took me to Children's Hospital in Sheffield, and literally all they did was local, cut it out, but there was a big mirror there. You're going, you can look if you want, and I'm going, no, thank you.
I would have. I'm into all that gory stuff.
What we're going to do is an ellipse excision of epidermal cyst, because that's what I think it is.
Yeah.
On scalp. Okay, so reasonably low risk procedure, but there are potential risks because it involves cutting skin. So I just need to let you know about that. So infection is one of them.
Yeah.
Bleeding.
Yeah.
If we get the cyst out whole, then the chances of it coming back are much less. Not impossible.
Yeah,
It's still a little cavity on it.
Yeah.
If we break the cyst, then it's much harder to get the whole sac out. And so actually that increases the chance of it, and we don't know until we do it, because it depends on whether I nick it with the scalpel.
Yeah.
So if you can sign away, unless you want to ask me anything.
No, that's fine. You explained it properly to me. Did you go anywhere or just took time off?
No, so it was a fasting month. So I was just taking time off to basically survive the last 2 weeks, really.
Oh, okay.
So
do you feel grumpy and no food or...?
No, actually, it's more the fatigue. It's more fatigue. Eating and drinking is not a problem. You get kind of sort of accustomed to it, yeah, absolutely. But yeah, I'm back to the land of the living, which is good news for you for today.
What happened to your bits and boobs straw?
Alison got rid of it when she came back because she didn't like it. And now there's bits and boobs everywhere.
This is my girlfriend. Nice to meet you both. How can I help?
Benzoyl peroxide.
Okay.
I was wondering if I can get some sort of benzoyl peroxide.
Yeah.
On my face.
Yeah, to get some more, yeah. Okay.
Duo or something. We was talking about Roaccutane.
Yeah.
I think that was something.
Yeah.
Roaccutane, but he was on about saying I need to get referred to the hospital or something for that.
Roaccutane is actually a brand name for the drug isotretinoin. And we use this medication in cases of moderate to severe acne, but more importantly in patients who we think are at risk perhaps of developing scarring as a result of their acne. So your acne, is it mainly just in your face, or does it affect your back and chest?
I don't know.
It's mostly the shoulders.
Yeah, my shoulders.
Shoulders and then face, okay. So How long have you been having treatment for your acne for?
I mean, I've had it for about 5 years now.
5 years,
I only
okay.
started getting treatment about 2 years ago.
Okay, so what we do next really depends on you. We can keep going with the cream and the tablets if you think that it's making visible differences for you.
I mean, at the moment, I'm using tea tree oil.
Okay.
I'm just like putting a bit of that on my face just before I go to bed. It burns and stuff like that, but like I get up in the morning, I have felt a significant difference between
that's
smoothness
fine.
and stuff like that.
I would say, looking at your skin, I'd classify this as moderate to perhaps quite severe acne in the way that it's presented on the face. And certainly my recommendation anyway would be that if you've tried for 2 years and it's still at this point, I think certainly a referral to a skin specialist and consideration of that specialist medication or Accutane is certainly worth considering. Unless you have some objections to that, unless you know.
That's fine,
Okay. When the dermatologist sees you, he will go through some of the risks and benefits of this medication, the Accutane, because it's not entirely straightforward. There are some side effects that he'll probably go through with you.
My uncle's partner had acne and she had Accutane and stuff like that.
So you kind of...
She was saying that it burns and stuff like that. But it made a hell of a difference.
Isotretinoin does require a lot of monitoring. It has been shown in some cases that the medication can have an effect on your mood and behaviour, and there have been some reports of people perhaps having thoughts of self-harm or even suicide with this medication. And so therefore it's usually initiated by a skin specialist or dermatologist. Okay, so what I'll do a referral and we'll give you some Epiduo and more of the tablets today. There you go. Okay. You'll hear from dermatology in the post with the appointment details.
Lovely.
All right.
Cheers.
Take care.
Darling, you sit right back and right up and you've got to make yourself really comfortable.
Okay, so the first bit, nothing fancy, I'm just going to draw on your head. Okay, so just going to do a sharp scratch now, okay? I'm going to put a little drape over you as well.
Okay.
Just thinking, can we move that? Probably there, that's good. I'm just going to check, can you feel any of this? No? I'm not feeling nothing now. It's really tense, isn't it, the scalp? We'll put a vessel early. Got a very nice vascular scalp.
Oh, have I?
Yes. So it's oozing away nicely.
Good, good.
So we've got the cyst out.
Okay.
And it's come out whole, which is good.
Perfect.
I'm sorry if I grab a few hairs doing this.
No, no. Leave me some, please. Sir.
I thought I might just try and even the scalp out for you, that's all. I'm just going to take this off and I'll just give it a bit of a cleaning. This is the hairdressing bit now. So again, you won't thank me when you have to take this off, but it's good for now. So 2 days, yeah, of keeping this dressing that we're putting on.
Okay.
It did bleed a little bit, so if it starts oozing through today, if it's going to happen, it's going to happen during the daytime today.
Okay.
And I want you to just walk in at the front desk and point at your head to the receptionist and they'll find something. It doesn't happen that often, but if it does start oozing through the dressing, then I want you to come back.
Okay, perfect.
Okay, Mum,
All right.
just sit forward for got some red streaks. So.
Highlights.
And the dressing, that remains on?
So sorry, yeah. So after 2 days, you could take all the dressings off,
Okay.
and you can leave it open and exposed to air.
Okay.
So that's the 2 days of completely dry and dressing on.
Yeah.
2 days time, take the dressing off, and then you can have a shower.
Okay.
Cool.
Yeah, no problem.
Good stuff. And the stitches out 10 days. Just let them know downstairs.
Yeah. Okay.
That's it. That's your lot. Thanks for your time. Thank you very much. Bye-bye. Bye. See ya.
The emergency doctor said she's picked me in.
And with the emergency doctor?
Yeah.
What's your name?
Alison Sloney.
Take a seat next door, please.
Hi, I'm Dr. Taylor.
Oh.
I've worked with you.
My son.
Okay. How can I help?
My back's pain, absolute shit. It's really bad. I can't rest. I haven't slept for 2 nights now. I've took sleeping drugs, but I still can't sleep.
How long have you been suffering with back pain for?
About 20 years.
So this is an ongoing thing?
Yeah.
Okay. And I can see you've seen the specialist as well?
Yeah, he said he can't do nothing for me.
Okay. Have you had physiotherapy and things for it as well?
Yeah, they said they can't do nothing.
Okay.
So I'm in limbo, you know.
How can I help you today?
Yesterday I had pains in my stomach, my lower back all day.
Just the last while I've been feeling a bit sick.
Those tablets are making me feel sick and horrible.
She has a bad cough, doctor. Day before night, she vomited.
And otherwise, has she been off her food at all?
Nothing
like that.
He was sick Monday night. He did start to have that sort of migraine-y, strainy look.
Just feel constantly sick all the time.
We go through quite a lot of these little sick bucket things. Surprisingly. Was someone sick today?
Yes. Hello, Samantha. Come on in and have a seat. I'm Dr. Bolger. We've met before, I think, haven't we? How can I help today?
Basically, I'm just struggling really with keeping the pain and the sickness under control. I've been vomiting since Wednesday, but I can't keep anything down now. My anti-sickness isn't doing anything now. I'm building that up.
What are you taking for anti-sickness?
Cyclizine 3 times a day. This morning I took my first painkillers about 5:15.
And which painkillers are we talking about?
Cocodamol, tramadol. I took morphine a couple of hours later, brought that up as well.
So you're taking tramadol, morphine, cocodamol?
Yeah. It's for the chronic pain condition. That's escalating now because I can't keep the...
And what's the plan with the chronic pain condition?
I'm waiting to see Hammersmith Hospital again. They're looking at my pancreas and the secretion. They can't seem to find out what is going on yet.
Right, OK. So let's check you over.
Thank you.
Feverish with it?
Cold,
yeah, hot and
I've had
cold.
diarrhoea and it's sort of hard to know if I've got bug because I have these symptoms so often.
It does come very often now, doesn't
Yeah,
it? Are you ever pain-free?
No, it's always there.
And they can't come up with any diagnosis for
No,
you?
they took my gallbladder out last year thinking that would
I
help.
remember,
It made it
yeah.
a bit worse.
OK, right, let's get you across. Let's check you over, yeah? So really, if we could stop you vomiting, you could
Yeah.
keep your painkillers down,
Yeah.
or you could keep your fluids, couldn't you?
That's it, it's a bit
So
of a cycle.
cyclizine,
Yeah.
which is a good anti-sickness pill. Have you been on any others?
They tried me on Dansetron, but that they worried we didn't track for my citalopram, and they tried me also on metoclopramide.
Show me where the pain is. Lift
Okay.
up for me. You're okay for me to examine you,
Yeah,
aren't you?
that's fine. So at
Right.
the moment it's here and it's going round to there.
And that's where it always is.
Yeah,
isn't
it keeps going shooting up to my shoulder. That's the worst bit.
Okay, that's fine. Come back
Thank you.
across. I'm trying to think of something we can try for the sickness that hasn't been tried. Let me just go through your notes. Because the other option is you going up to A&E.
Yeah, I just kind of avoid. Only
I know, I
because
can understand that.
I'm in for a few days normally. I'm normally in every month, but I've avoided it for the last few weeks. But I feel like I'm sort of.
On the edge?
Yeah, and I feel like I'm just being stubborn now. So I think I probably do have to go back in, but. I think I'm just in panic mode at the moment. What's left to try about going back? But I think I might have to.
You've had the domperidone, they've tried it before. We could
Yeah.
try it short term. They're right, it's not a long term solution, but just to see if we could try and get you to keep some fluids down.
Yeah.
The other alternative is A&E. Should we
Okay.
try some domperidone at least during the course of today?
I'm happy to take some time.
I think if this doesn't work, then you need to either call us again or go up to A&E as you normally do.
Thank you.
It's no problem.
Where in the back is the pain?
It's just there.
Across the lower back. Yeah. Does it move anywhere, or does it stay in the back?
It goes in my legs.
So it goes in your legs.
And my fingers.
Okay. And have you got normal control over your bowels and your bladder? Not having any accidents?
No, but it's like my bum's numb.
Okay. And has anything happened recently? Any injury or any trauma? Fine.
What I'd like to do today is examine you.
Can you wait outside a minute, please? Thank you, Jonathan.
Okay.
Yeah. Sorry about this.
Not at all. You have to be sorry.
I'm
sorry that you're in so much pain.
I don't normally come as well.
What we're going to ask you to do is just to lie on the couch for me. Just stay.
I'm going to tap on the legs, and I want you to say yes when you feel me tap, okay?
Sorry. Oh, God.
You okay for me to continue?
Yeah. It's really bad.
Do you want to sit up for a second?
Yeah.
Yeah. I'll give you a hand. Just take a second.
Oh, I feel dizzy.
I'll get a lady to come in. Got my colleague Hannah with me, okay? So I'm going to be examining the back bottom, okay? So what I'm going to ask Hannah to do is just to kind of be with us when I examine you, all right? So I'm going to wind the curtain round. And if you just lower your bottom things, yep, okay. Okay, so all I need you to do is say, number one, whether you feel it, and then number two, I'm going to ask you to squeeze down on my finger, okay? Okay, can you feel that there?
Yes.
Now, what I'd like you to do is now try and just squeeze down on my finger.
That's it, I can't do it.
And just try one more time. That's fine, okay. Thanks. Alrighty. So, the reason I examined you is wanted to just make sure that there's no other sort of concerning signs that your nerves are being involved in your back pain, okay, which I don't think they are. It's not really a painkiller that you need, but actually something to release some of the tension in the muscles, because I think it's the spasm that's causing most of this pain at the moment.
Okay, what do I do then?
So there's something called diazepam, which you've probably had before. Yeah, and I would like to maybe try a short course of that, maybe 5 days worth, to take it three times a day, and that might just help ease the spasm. Now, obviously, in that time, if the pain gets worse, if you start losing control of your bladder, your bowel, or the numbness gets worse, then you come back and let us know. Okay? Let's try that and see how you get on.
All right,
okay.
then.
All right.
Cheers.
You're welcome.
Thank you.
Okay, take care. Bye-bye.
Jonathan.
One morning last week, we were walking across the road by the scout hut, and some bloke's gone past with a dog, walked down that sort of alleyway. Short-sleeve T-shirt and shorts. I thought, bloody freak. I had a jacket on, a scarf on, gloves on, and he's got a short-sleeve T-shirt and shorts.
So a bloke walks past the house in the morning with the dog, and he's got his shorts on. I figured, oh, that time of the morning, not awake then.
Okay, so let's have a look. So you had some bleeding, did you?
Yeah.
That's settled now?
I haven't done anything since, gosh.
Okay. So you're quite keen to start HRT? Okay.
I don't know what it is.
Okay,
I've heard about
it's hormone replacement therapy, so it's basically replacing the hormones that you previously had.
Yeah.
And when did you go through the menopause?
Oh, God, well, I didn't know I was. I'd say from when I had Riley.
Okay, 42. Okay. So you're using any form of contraception at the moment? Okay.
I ain't done anything.
Okay.
Got no sex drive, nothing.
Okay. And how are you feeling otherwise?
I'm a bit of a mad, a bit moody and, you know.
So the estrogen will help with that, okay? So there's two main female hormones, and one's called estrogen, one's called progesterone, and they do different things, okay? But we'd have to replace both of them. It has lots of positive effects, okay? So, you know, and it has, you know, helps protect against osteoporosis and things like that. But unfortunately, estrogen has also a few not so great things, and that's why I don't know if you know about all the bad press that went along with HRT and things, that the risks of sort of developing blood clots.
But obviously you keep an eye on things like that.
Completely. So we would expect you to come in every 6 months, have a blood pressure check, talk through how you're feeling. But it's for you to be aware of, because actually they're quite, although the risks are very, very low.
Quite serious things.
Completely. Okay, so there's lots of good things and lots of bad things.
Scaring the life out of me now. Go on.
No, I just need to tell you, I mean, it's about trialling it, okay, and obviously doing all that you can to keep your risks down. I'm naming big names, but the risks are very small, but obviously the cancers of the womb and the ovary as well, but that's where the progesterone comes in, okay, because estrogen will build up the lining of your womb again, okay, which is a risk factor for developing cancer of the womb. So what the progesterone do will just shed it away, so you'll have a bleed every month like you used to.
Oh, really?
Yeah, completely.
Great. I don't get any now.
Okay, so it's just one tablet every day. I want you to come back and see us before you run out. If you develop any pain in the leg, in the chest, stop taking them straight away, see a doctor, okay? Have a read of the leaflet.
Will it be severe pain? I know it's not right pain, won't I?
Yeah. It won't be something little, okay? But if you've got any concerns, please do come and discuss it with one of us.
If I just think something's not right, so just not take the next one and then make an appointment.
Well, you can actually just speak to a doctor over the phone and say, look, I've just started taking it. Can you just check? All right, so don't worry.
Yeah, thank you very much.
Bye-bye.
Cheers, bye.
Oh, I'm having stir fry for dinner. Woohoo!
What are you having for dinner?
Stir fry. I haven't had stir fry in ages.
Are you making it?
I'm technically making it because I'll be putting my noodles with my stir fry and then like put it all together.
That's a stir fry.
I'm putting it on my plate. Yeah. Kind of making it, I guess. You're stirring it in a pan? I'm stirring it and frying it.
Hello.
Hello.
Right, which one's John?
Me.
All right, have a seat, John. I'm Julie, how can I help?
Every time I breathe in, I get a pain in my chest.
All right, okay. How long's that been going on for?
Since yesterday. You can hear it.
Oh, I can hear the wheeze, yeah. And it's normally asthma, Mum, or?
Yeah, he's got a little bit of a tight chest.
Yeah, so has he used inhalers before?
No.
No. Okay. All right, we're just going to...
When he was younger, yeah.
When he was younger?
Yeah, he was quite asthmatic, like...
Oh, he did have asthma when he was younger?
Younger, yeah.
Right, just stand up for me. That's it. Just breathe in and out through your mouth. You're quite wheezy there, aren't you? Just have a seat, John. Let's pop your finger.
Jimmy.
That's a good one. Okay. So what I'd like to do is give him the nebulizer, okay, and then I'll check him again.
Is it very serious?
No, darling, it's just your asthma that's just come back, that's all. I'll give you the medicine through the mask.
Morning, Timothy. Hi.
Morning.
Come through, come and grab a seat. Thank you for waiting. Sorry about the delay, Timothy. How can I help today?
Right, I need a full range cholesterol test.
Yep.
And I've got a broken rib, at least one broken rib.
Okay, all right. In terms of medication, what medication are you taking at the moment, Timothy?
At the moment, just amulosine, but I'm going to start taking my heart medication again.
Have you ever had a heart attack before?
Yes, I've had two.
Okay. And in terms of the heart medication, why did you stop the heart medication?
I was having too many side effects and...
Okay. The medication that you're given is very good medication. Has actually been shown to be protective after people have had heart attacks.
Yeah.
Okay. So patients who've had heart attacks, they should be on these medications.
Well, yeah.
Yeah. And Timothy, the other question I have for you is, in terms of alcohol, how much alcohol are you drinking at the moment?
Probably about 2 pints a day.
Okay. And have you tried to cut down?
I don't need to. I have a thiamine deficiency and I drink Guinness, which prescribed by a consultant 20 years ago.
Thiamine is a B vitamin, and its deficiency can result in multiple signs and symptoms, and it can affect the cardiovascular, neurological, and gastrointestinal tracts. Some of the signs and symptoms include nausea, vomiting, and fatigue.
I became deficient in thiamine, and I ended up being seriously ill for 9 months, and I ended up in hospital. And a friend took me out for a drink. I had 2 pints of Guinness, and I was cured.
Most people associate Guinness with high iron content. Guinness or any other alcohol is not a recommended treatment for thiamine or iron deficiency. We can treat both of these with effective nutrition, and also if it's severe, we can give medication. There's well-documented evidence about what safe levels of drinking are.
That's right.
And safe level of drinking for men, now the current guidance is 14 units per week.
Yeah, well, I drink 1 can of Guinness in the morning and 1 at night.
Okay, so 14 units per week, and you should have at least 2 alcohol-free days in a week. That's the safe
No,
limit.
if I had 2 alcohol-free days, I wouldn't be able to work.
Listen to your tummy. Do you want to put it on for me? I can hear your lunch. What did you have for lunch?
Peanut butter sandwich.
Peanut butter sandwich. I had peanut butter sandwich as well.
You've got 2 girlfriends? Oh, that's a lot.
We'll have some more.
Oh, what's your son up to?
How is your vacation going?
Well done.
Where are you off to, mister?
Thank you.
You're very welcome. All right. I hope you feel better.
So all it is, it's just the medicine, but it's just going through the mask, and it'll be like steam that comes out. Okay, so like steam in your face. You just have to breathe normally. That's it, good boy. Oh, it helps if I plug you in. Right, can you jump up off there for me, and I'll just start writing up his notes. That's it, good lad.
Hopefully don't get worse.
So can you remember when he last used inhalers, Mum?
It's usually during the summer.
Just sometimes in the summer with hay fever, he might have some problems. And then does he use the blue inhaler? Don't press on anything, as it might all disappear.
Feel better, Jimmy? In your chest.
Are you feeling any easier?
Yeah, it's feeling a lot easier, but I can still feel that a little bit.
Just...
Oh, no. Thomas is looking straight at you.
I have to.
You're very curious, aren't you?
Kevin. I'm gonna go back in. It's just I'm asking these 2 to stop laying up a bit.
Wait till that stops steaming. Just keep shaking it slightly just to get rid of those last few drops. Don't feel any better when you're breathing in?
Yeah.
Yeah?
I can breathe deeper now.
Good, good. So what I'll do, Mum, I'll give him some inhalers, and I just want to check his chest again. It's in your purse.
Kevin, well, I'm talking to the nurse. Yeah, in a minute, Kevin.
Unless I have Guinness, I can't work.
Do you ever feel shaky in the morning?
No.
Do you ever crave the alcohol?
No. I don't even like the taste of Guinness.
My job is to make sure that you live until you're 150, all right? That's my job.
And you just have to take it from me that if a consultant recommends that I have 2 pints of Guinness a day,
yeah,
and I know that to be a fact.
Timothy,
Again.
I can assure you, as your GP today,
Yeah.
that it is not good for your health, okay? It's important in our role as general practitioners that when we encounter patients who don't want to change their ways, that we don't get frustrated. And our job is to offer the correct evidence-based advice to hopefully allow the patient to one day change their ways and adhere to the correct treatment plan.
I know my body, so there's no point you trying to tell me that it's not.
Sure.
Your opinion on Guinness is totally different from my experience.
Sure.
I don't drink excess alcohol.
Okay. Now, Timothy, in terms of the broken ribs, tell me what happened.
I fell off a motorbike in Kenya
When was that?
about a month ago.
Soreness on the right side of the chest. have you?
Yeah.
What I want you to do is stand up for me. The pain, is that tender there?
Yeah, just a little bit.
Okay.
Yeah.
Turn around.
Broken rib is in
Turn
that
around.
area.
Okay. Take some big breaths in and out. And out. And again. And out. in terms of the chest,
I need an X-ray.
for a broken rib or for a query broken rib, we do not X-ray unless there's certain indications. That makes sense. Your chest is clear. There's no evidence that you have an infection in the chest, which is good. You've got good air entry on both sides. Your oxygen levels are perfect, so you do not need an X-ray.
Right, so you're confident that the rib is healing up?
Even if it was broken,
Yeah.
we don't X-ray because the treatment, whether it's broken or not broken, doesn't change. It's pain relief, and it will heal.
No, that's not strictly true, because if the rib is not healing correctly...
Yeah, because at the moment there's no indication for us to get the X-ray.
Right.
Keep going with the pain relief, and this should settle down, okay?
Yeah.
If it's not settled down in the next 3 to 4 weeks' time, you come back in and see us.
3 to 6 weeks, a rib's supposed to heal.
So, Timothy, in terms of moving forward now, okay, take the pain relief and let's see how we go. All right then, baby.
Thanks a lot.
No trouble.
So I think we'll treat him full on as asthmatic with the steroid inhaler and just to get on top of things.
Jimmy's not feeling well, Kevin, so you've got to just have patience.
Right, lovely. I think that's done now, isn't it? That's it. Good lad. Okay, so I just need to have a look at your brother again now. Okay, so you stand over there with Mum.
Good boy, Luke. Stand
That's
here.
it. Let's have you on the scales then. That's it. Okay, 48.
Stone.
No, that's kilograms. Okay, you jump up because I need to be here. That's it, thank you.
Kilograms.
Right, let me just check your chest again and then we'll get your medication.
It's a lot less squeaky than it was before.
Yeah. There's still a little bit of a squeak there, but it's a lot better. Sounds a lot better.
Luke, Kevin, why are you doing this, Kevin?
So he'll definitely need some steroids. Okay, jump up.
Don't steroids make you get muscly.
They might do, eh? So I'll give you a brown inhaler. Okay, so take 2 puffs in the morning, 2 puffs in the evening.
Okay.
And a blue inhaler. Okay, so the blue inhaler you take, whilst your chest is bad, take it every 4 hours.
So the brown one, 2 in the morning
And 2 in the evening, right.
Are we going in now?
What do you say, boys?
Twice in the morning, twice in the evening.
What do you say, boys?
Well done.
And
You take it to nurse, okay? Thank you ever so much, nurse. I appreciate that. Lot.
All right then, take care. Okay.
Bye-bye. Say bye-bye, boys.
Stickers. There you go.
Thank you.
All right
Thanks
then,
ever so
bye-bye.
much. Bye-bye.
We'll see you next time.
Yeah.
All right. Bye-bye.
Excellent.
Thank you very much.
No trouble. Love to see you. Bye-bye.
Sorry to be a pain.
You're not a pain at all. I'll see you in a couple of weeks. Yeah?
Thank you very much.
Bye-bye.
Bye-bye.